Let's go. My name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access South Louisiana. I live in New Orleans, Louisiana, and I love living there. And I also serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for over a year. In fact, I just looked at our submission for April 2nd of 2020. Boy, do I look awkward. A little bit more relaxed after doing these for a year. Anyway, in conjunction with the leadership of the ACOI, hello leadership, thank you for letting me do these videos. I hope these messages are helping you to keep up with the latest on COVID-19. I know that many of you are in the thick of the fight, and I'd like to thank all of you on behalf of all of us who focus on infectious diseases for a living, and certainly on behalf of the ACOI. Hello ACOI. So, also, on behalf of the ACOI, I need to ask you, are you registered for the ACOI virtual spring meetings? There are 3 meetings coming up in early May, on May 11th through the 15th, and they're focusing on 3 important areas, and all with an opportunity to earn much needed CME credits. Check out the ACOI website. I'll be lecturing at them. Anyway, guess what? If you register before April 20th, that's in 18 days. If you're watching this on the 2nd, you get the early bird discount for the meeting, and you'll also get $100 off the annual ACOI convention and scientific sessions. Speaking of that annual convention, I'm actually very curious about it. What is going on with that convention? Are we going to actually be meeting in person? Please, 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 please. I got my vaccine. But to find out more, stay tuned, and there will be more information that will be announced shortly. Moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some hopeful progress that we are seeing. On to the stories. Dangers of relaxing COVID standards too quickly. I know we all want to hang out. I know I do. I want to go to the ACOI convention. For us to be able to do that, we cannot relax our standards too quickly, and Dr. Rochelle Walensky, who is the chief of the CDC, also agrees with that as well. She made the media rounds this past weekend with a stern warning for states relaxing mask mandates. She said, don't do it. And my friend Dr. Fauci, you owe me a phone call. My friend Dr. Fauci agrees that opening up now and dropping the mask mandates is premature, given the level of infection currently in the U.S. The U.S. has now passed 30 million total confirmed cases of COVID-19, and the most recent 7-day average is just below 60,000 cases per day. That's a 10% increase compared with the previous week. That is not good news. Even so, look around the world. The pandemic is alive and thriving, unfortunately, in many countries, especially in South America and Europe. Brazil, Sweden, and France are all experiencing an uptick. And both Dr. Walensky and Dr. Fauci, 2 awesome infectious disease doctors, I might add, Dr. Walensky and Dr. Fauci fear that the U.S. will see a rapid rise if we are not careful. In the U.S., hospitalization rates are going up, and we are currently at 48,000 admissions per day. But while there are millions of Americans now receiving vaccinations, the progress toward herd immunity has not kept pace as we are starting to see a 4th wave of infections, with cases rising in half of all U.S. states, specifically New York, and especially New York City, in Michigan, New Jersey, Connecticut, and in Pennsylvania. So we need to plead with our patients to continue masking, continue social distancing, and get the vaccine. We are too close now to give up the fight. Now, the CDC also just announced that COVID-19 was officially the 3rd underlying cause of death in 2020 after heart disease and cancer. My goodness. COVID-19 deaths were higher in American Indian and Alaska Native persons, Hispanic, Black Americans, Native Hawaiians, and Pacific Islander persons. Yes. In fact, Dr. Walensky said among nearly all of the ethnic and racial minority groups, COVID-19 related deaths were more than double the death rate of non-Hispanic white persons. And looking at it another way, COVID-19 was reported as either the underlying cause of death or contributing cause of death of over just 11% of U.S. fatalities, and replaced suicide as one of the top 10 leading causes of death. Oy. All right, as my grandmother would say, oy vey. All right, on the vaccine front, however, all right, the U.S. does have good news. Among seniors, 73% have now received at least their first dose. Among U.S. adults, 36% have at least received one dose, and more than 50 million Americans are now fully vaccinated. That's amazing. And what we've seen now in long-term facilities, we've seen something like 95% vaccine uptake and a complete elimination of outbreaks in senior living facilities. So that's amazing. Now, vaccine manufacturers are doing their part. They are keeping up with production, and the Johnson & Johnson vaccine will soon be available with an initial 11 million doses. Please, bring it on. We need that J&J vaccine. We need that one-dose vaccine. Now, the federal government is expanding vaccination sites so that 90% of Americans can also get a vaccine within 5 miles of their homes. That's amazing. And also, more Americans are going to be eligible by April 19th. More than 90% of American adults will be available to receive the vaccine. The government is also addressing transportation issues for seniors. They're helping seniors and those with disabilities to get a vaccination as well. And I know in my hometown of New Orleans, we are going to people's homes, directly into their homes that can't leave their homes, or that mobility is very difficult for them. And we're actually going and vaccinating folks directly in their homes, and that's amazing. So, also, on the good news front, Pfizer and BioNTech just released some really great data this past week, and that was in teenagers. So how does it work in teenagers? Until recently, teens under 16 were not given the green light to go ahead and get the COVID-19 vaccine. But data just released from Pfizer and BioNTech, their phase 3 clinical trials indicate that it is indeed safe for children, kids between the ages of 12 and 15. How cool is that? So data also revealed that the vaccine is 100% effective in preventing symptomatic infections in that age group. Wow, it's super cool. Kids had side effects similar to adults, of course, because they have a very robust immune system. And the main side effect was pain at the injection site, fever, chills, and fatigue. And most of those felt that after a second dose. The Pfizer vaccine has already been authorized for use in people in the U.S., obviously, for those that are over 16. So my good friend Dr. Fauci, who still owes me a phone call, thinks that the U.S. could start getting older children vaccinated before the school year begins this fall, and younger kids maybe early next year. So Moderna is starting to test its vaccines on kids younger than 12, and Johnson & Johnson is going to be testing its single-shot vaccines in infants, and they will be testing that in older children as well. Pfizer is starting a clinical trial testing its vaccine on healthy 6-month to 11-year-old children. So they are really going to be testing younger and younger. That's great. And next on the horizon, Pfizer and BioNTech has announced that the start of the phase 1, 2, and 3 clinical trials to assess safety, tolerability, and immune responses to their vaccines among children between the ages of 6 and 11 will be ongoing. Lastly, let's talk about something that is so incredibly important, which is a resumption of what America used to have, which was a public health corps, and we're going to be doing that now in what appears to be a community core for COVID-19. So gaining the public trust in public health measures is often the most challenging part for any program to help us become healthier, and understanding that the U.S. Department of Health and Human Services and the Centers for Disease Control are teaming up to create a community program to boost the country's confidence about vaccines and encourage communities to get vaccinated. And the concept is to enlist the help of trusted voices in both local and national communities to help disseminate science-based information directly to the public in a more approachable manner. I love that idea. I love that idea. If they need somebody to help do something like that or run it or something, I'm not saying I have the time, but I do have ideas. Anyway, doctors, nurses, and other healthcare workers are being approached to become the founding members of this core. That's something. And together with the federal government, they will be equipping these community partners with great information to help make an impact. The COVID-19 Community Core will receive weekly scientific updates and social media suggestions, infographics, and tools that will help people find ways to get vaccinated. I am super optimistic about this approach. I really do believe that it can work well. It does localize the messages and uses known and trusted community members to provide that encouragement. And then also, lastly here, I do want to get your thoughts on this, as I really do believe that part of our training in medical school and in public health school or whatever, I really do believe needs to include a media and public speaking elements as well, where we are trained to learn to talk to the public, just like something like this, using best practices. I think that we all do a great job caring for our patients and doing what it is that we do, but I think that equally as important is when we find ourselves in situations like this, that we lean on lessons learned in school, where we would be able to speak directly to the public using the best practices known. So that's something that I'm hopeful for as we move forward to the future. So stay on the lookout for our regular updates, and to read more from the sources used in this report, go to the ACOI. Go to the acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of the crisis. Also, I love hearing from you, so please feel free to reach out to me anytime at madery@mac.com. Please stay safe. I know that we can do this together.